Hi everyone, today I am read chapter minerals. Topics of this chapter are introduction of minerals, classification of minerals and brief study about sodium, potassium, magnesium, zinc and phosphorus. First I am read about introduction of minerals. Minerals are inorganic compounds required for normal body functions. Second, I am read about classification of minerals. Minerals are divided into two groups. First, major element. These are required in large quantities, hence it is known as major element. Sodium, potassium, calcium, magnesium, phosphorus, etc. Second, trace element. These are required in minor quantities, hence it is known as trace element. Iron, iodine, zinc, copper, fluorine, etc. Now I am read about sodium. It is widely distributed in the extracellular fluid. The daily requirement of sodium is about 5 to 10 gram per day. It maintains extracellular fluid volume, acid-base balance, excitability of muscle and nerve tissues. Sodium chloride is used to improve the palatability of food. Sodium is lost from the body mainly through urine and sweat. Excess loss of sodium can lead to hyponatremia. Severe sweating, diuretic therapy, burns, diarrhea, etc. are some of the common causes of hyponatremia. The signs and symptoms are anorexia, muscle cramps, hypotension, tachycardia, etc. It can be treated by giving salt through food or normal 0.9% intravenous saline. Increased sodium level in blood is known as hypernatremia. Common causes are congestive cardiac failure and kidney disease. The manifestations are edema, altered mental status, rise in blood pressure, etc. It can be treated with salt restricted diet and loop diuretics. Now I am read about potassium. It is an important constituent of intracellular fluid. Normal serum potassium level is 3.5 to 5 milliequivalent per liter. The important sources are tender coconut water, banana, orange, nuts, etc. It is required for maintenance of muscular and neural activity. It also helps in the regulating acid-base balance, fluid and electrolyte balance. Serum potassium level less than 3 milliequivalent per liter is known as hypokalemia. Common causes are excess sweating, severe vomiting, diarrhea, diabetic ketoacidosis, diuretic therapy, and renal disease. The clinical features are muscular weakness, lethargy, arrhythmia, hypotension, etc. It can be corrected by oral potassium salt. In severe cases, potassium can be injected slowly intravenous as it has cardiac depressant effect. Serum potassium level more than 5 milliequivalent per liter is known as hyperkalemia. Renal failure, drugs like non-steroidal anti-inflammatory drugs, ACE inhibitors and potassium-sparing diuretics, tissues damage due to trauma and burns, etc. are some of the common causes of hyperkalemia. It can cause cardiac arrhythmia, paralysis of skeletal muscle and cardiac arrest. Drugs used to treat hyperkalemia are 10% calcium gluconate, salbutamol, terbutaline, regular insulin with glucose, sodium polystyrene sulfonate. Severe cases can be treated by hemodialysis. Now I am read about magnesium. It is mainly present in bones and teeth. The daily requirement of magnesium is 0.3 to 0.35 gram per day. The important sources are green leafy vegetables, fish, coconut and food grains. Uses of magnesium. First, as an antacid. Magnesium salts are used commonly with aluminum salts. Second, as a purgative. Magnesium salts are used as osmotic purgatives. Third, to reduce raised intracranial tension, magnesium sulfate can be used rectally. Fourth, to control conversion in eclampsia and treat cardiac arrhythmia, magnesium sulfate can be used parenterally. Fifth, magnesium sulfate can be used topically to relieve local edema. Hypermagnesemia is treated with 10% calcium gluconate, slowly intravenous. Hypomagnesemia is treated with magnesium salt. Now I am read about zinc. It is an important cofactor of many enzymes such as alkaline phosphatase, carbonic anhydrase, lactate dehydrogenase, etc. Egg, meat, liver, pulses, cereals, fruit, nuts, vegetables, etc. are important sources of zinc. Salt like zinc oxide, zinc sulfate, and zinc carbonates have antiseptic actions. Deficiency of zinc causes delayed wound healing, alopecia, dermatitis, growth retardation, etc. Preparations of zinc. First, zinc oxide. It is used topically in eczema, hemorrhoids, skin infections, for wounds and nappy races in the children. Second, zinc sulfate. It is used to facilitate healing of ulcers and conjunctivitis. It is used orally in acute diarrhea as it helps to heal intestinal epithelium. thus decreasing the frequency and severity of diarrheal episodes. Third, zinc carbonate. It is a major component in calamine lotion. It is available as a lotion in powder and can be used for eczema, sunburn and skin rashes. Now I am read about phosphorus. The important sources of phosphorus are fish, meat, egg, milk, pulses and cereals. The daily requirement of phosphorus is 0.8 to 1 gram per day. It is required for the formation of bone and teeth along with calcium. It also helps in the maintenance of acid-base balance. Hypophosphatemia may occur due to dietary deficiency of phosphorus, chronic use of antacids, hyperparathyroidism, vitamin D deficiency, diabetic ketoacidosis, chronic alcoholism, etc. Clinical features are anorexia, muscle weakness, pain in muscle and bones. It can be treated by management of underlying disease and administrations of phosphorus salt orally or intravenous depending on the severity. Hyperphosphatemia may occur in the hyperparathyroidism, renal disease, etc. The signs and symptoms include hypokalemia and bone resorption. It can be treated by administration of calcium carbonate and aluminum hydroxide. They retard the absorption of phosphorus from the gut